I think the important comments and discussion was about our colleagues in private practice. I'm a little bit nervous to ask how will this relate to state practice, in particular. Psychiatry in state hospitals often don't deal with people who are there voluntarily. They are there against their will. They've lost their capacity to give informed consent. Under-resourced, overcrowded, definitely not having the choice to say who we want to treat. So I'm just wondering how all of this, so the nervousness, perhaps the little state funds that may be around will then disappear if lawyers found this out. Or should we just think that our consumers may not have access to legal services? But to state, how does this all translate to state sector?
Okay, bad news is we have found this out a long time ago. The good news is that it is the state that's liable. So as physicians, you are employees. It's true you are liable individually, but the state is vicariously liable. And the rule of litigation is go for the deep pocket defendant, which would be the state. Having said that, I think one's got to understand it is malpractice litigation. It doesn't matter whether it's against lawyers, engineers, architects, or doctors. Malpractice litigation has a very important role to play in the maintenance and enhancement of professional standards, because it keeps us all accountable. It really does. I mean, since I got sued 20 years ago, in particular, one of my PAs was responsible. You put in place new procedures. You recognise there was a gap, there was a deficiency, that things, you should have done it better, and going forward you do it better. If there was no accountability for surgeons that do hysterectomies where there's no indication, simply because they want to go overseas at the end of the year, you'd be amazed how many there are. I've sued too many to tell you about. GPs that do a 6-week course in plastic surgery and then proceed to butcher young women with liposuction, breast augmentation, breast reduction, and the like. And it's only through litigation that such persons are held accountable. So there is a place. But having said that, obviously, the pendulum should not swing too far in either direction. And I think in South Africa, state health, government has got to learn the painful lesson. And I think they're starting to learn it. That proper resource provision, proper maintenance of standards is going to be cheaper than paying out the claims. Because if your staff are disciplined and you don't have nurses toy-toying while patients are dying and ventilators are switched off, if you do have staff washing their hands, basic hygiene, and cutting their fingernails and not wearing nail polish, because that's what's going on in state hospital, I can tell you. And they're acting as scrub sisters in some cases. You've got to have, in the nursing profession, you've got to have discipline, you've got to have hygiene, you've got to have proper sepsis control, you've got to have sterile, decent, clean bedding, you've got to have no cockroaches, you've got to have no rats, you've got to have electricity, you've got to have drugs, and it just goes on and on. And government has got to learn, and it will learn. It's going to be cheaper to partner with private enterprise to run hospitals properly. I mean, I think of Baragwanath Hospital in Johannesburg. It was a major learning institution. People would come from all over the world to learn. Not saying it doesn't happen now, but it is filthy and rat-infested. What was the Johannesburg Hospital, which was a flagship. If you really got sick and you'd exhausted private options, the one place you'd go to would be the Johannesburg Hospital. We had the professor and the registrars and the interns and nurses in crisp, clean white uniforms, observing discipline and instructions and proper hygiene, and patients got treated with dignity and properly and got treated and got cured and so on and so forth. We need to get back to that situation, and I think government is starting to learn. Unfortunately, the Deputy Minister of Health got killed in a motor accident, I think, last year. Yeah, and he had tremendous initiative, and I met with him a number of occasions because he wanted to get ideas as to what needs to be done. He thought I might make some small contribution there. And I think Mr. Motsoaledi, with respect, is not recognizing the problem. And I've heard mutterings by him that he wants to do something about all this litigation, that doctors should be in hospital, lawyers in court, not the other way around. That's killing the messenger. The problem needs to be addressed, and it's the bulk of our population who are dependent on state health care, and surely they're entitled to be treated decently and have proper facilities. It's not that there's no money, because we know what's happening. There's political appointment of hospital managers, the cadre deployment, and you haven't. I think they were going to appoint someone. I don't want to say too much, but the bottom line is you've got to have medical doctors running hospitals. You can't have someone with a standard 8 or a chartered accountant. And we need to get back to the health standards that South Africa can and used to deliver in the public sector. It's so important.